just state your name so the record knows who each of you is.
So my name is Marina Tsaplina. Thank you so much for being here on this late hour. I wanted to just open with showing this image, which helps to paint the picture of the reality for people with diabetes.
I need you to be by the microphone so that people at home can hear.
Hold it. Thank you so much. So that was before insulin, the invention of insulin, and that was after. It just helps to see because you see me as an able-bodied person. So please just keep that in your mind. As I speak, I hold in my consciousness the people whose lives our senseless health system has taken. I live in Brooklyn, New York. My mother, who just left, lives in Staten Island. I testify to make visible the structural violence that this health system inflicts on the bodies of people with diabetes, clinicians, and families. I testify to the moral failing at the root of our health crisis, one that I have witnessed and participated in when leading an industry-supported patient advocacy organization. I testify to stop the growth of evil by calling it by its name and taking responsibility for my role in it. I was diagnosed with type 1 diabetes in the Soviet Union in 1988. I was 2 years old. My family moved to the US largely because of my illness, driven by a dream of America, a hunger for a politics of integrity, and a belief that I would have the best chance to flourish here. And yet here I am, uninsured. Diabetes was fatal until the discovery of insulin in 1921. Its patent was sold for $1 as its discoverers believed it was unethical to profit off of a life-saving drug, yet I cannot afford my medicine in 2019. Drop the word care from this health system. This system is organized around neglect. There is no such thing as a pre-existing condition. It was made up to deny care. Being insured is often no better than being uninsured, and the structural neglect is violence. Amputation rates for people with diabetes between the ages of 18 to 44 have increased after 2 decades of steady decline due to the instability and unaffordability of both health coverage and medicine. Despite vocal commitment to medical innovation and claims to universal health coverage, the first great breakthrough in modern medicine is today the 6th most expensive liquid in the world, and I have not had a doctor's appointment in 5 years. Call evil by its name. The system of neglect is the result of a great moral failing that is captured in this phrase: prices should reflect the therapeutic value of medicine and positive outcomes to society. It sounds innocent, but the therapeutic value of insulin is my life. Pharmaceutical and health insurance market, what is the price of my body that needs insulin, regular checkups on my internal organs, and a stable relationship with my clinician? Tell me the price of my body. Or does that question summon the ghosts of America's past? The cost of a health system guided by unrestrained profit and the illusion of choice is paid for by the loss of feet, eyes, kidneys, hands, husbands, mothers, wives, fathers, sisters, brothers, and children. In Kentucky, a son was taken from a family because they could not afford his diabetes supplies. Clinicians, nurses, doctors, who have the highest suicide rate of any profession. The trust due to moral injury, it's not burnout, it's moral injury. It's been reframed. The trust fundamental to the therapeutic relationship between clinician and patient cannot survive in a system that holds the bottom line above the relationship. This perversion shatters the bedrock of healthcare. Care cannot survive here. Evil grows where men and women are willing to sacrifice truth on the altars of their self-interest. And we must never forget, said the great Martin Luther King, that evil never voluntarily relinquishes its throne. I call evil by its name and I claim my role in it. My organization focused on the psychosocial and mental health aspects of living with chronic illness, and I accepted $40,000 from the pharmaceutical industry to support its work. Was evil in my fingers when I hesitated to write publicly about the ravishing price of insulin for fear of not being funded in the future? Was evil in the words of the new CEO of JDRF, who himself lives with type 1 diabetes, the global type 1 diabetes charity, when he told me, quote, pharma is taking advantage of a corrupt healthcare system, but did not directly say that it is a driver of corruption with its patent abuse and the death of Alec Rayshawn Smith? Was evil in the silence of a group of patient advocates who, when the hashtag patients over profits was rejected in an industry-supported diabetes advocacy campaign, said nothing? All that the growth of evil requires are small daily violations by the hands of many good people. How this system is currently organized is incapable of bringing good care to the majority of the people in this state and country, and for this reason, I call on this body to bring the New York Health Act into law.
Hi, my name is Gail Myers, and I'm the Deputy Director of New York Statewide Senior Action Council.
Thank you, Ms. Myers. And one thing, Tsaplina, I wanted to make sure that I pronounced it correctly. Thank you for your testimony. It is always important to hear from folks who are directly impacted. You've been here for most of the day, or probably all of the day, so you've heard some of the moral conversations as well as the practical conversations, and not only do you speak as someone who is a diabetic yourself, but an advocate for diabetics. And I guess you said most everything in your testimony, but I just wanted to give you an opportunity. First of all, I should tell you that some of the stuff that they're doing in Colorado, that's very interesting, and we're actually talking about it here, but we'll see how that develops.
We'll be talking to you.
Please do. But then, if you had an opportunity to speak to some of the folks who are, in particular, I'm concerned. I'm not concerned, but it is hard for me to understand how folks are saying that they want to defend the current system when what you're describing is what individuals are currently living through, and I believe that in your case, you're uninsured, but you also talk to folks who are diabetic and are insured and still have issues of access, correct?
So I am uninsured,
yes,
and yes, and there are a lot of people with diabetes who are insured and who cannot afford their basic needs of insulin, diabetes strips, and glucose monitors.
And so it is just something that I just felt needed to be underlined as much as possible, that we're talking so much about individuals who are insured, and folks who are going, down battling for the current environment. It just doesn't make sense to me. I don't know if it makes sense to you.
Yes, and I think that lack of sense-making really does emerge from the belief that prices should reflect the therapeutic value of medicine or medical care. Which just does not match the need of an endless need for people with diabetes, for anybody who has a mortal body, which is everybody. So there is a refusal. I have watched the hearings on Capitol Hill. There is a refusal to aggressively target the corruption of an unregulated healthcare market. And until I want New York City and New York State to be unified as a voice on Capitol Hill, fighting against powers that are so strong and they are so subtle in how they corrupt, because I spent 5 years speaking to people in those industries. They're not evil. That's not what I'm saying.
And by the way, we're fighting on this hill too, which is why I'm glad that you're here with us. I want to go back to the assembly, but thank you for being here.
Okay. Other questions? If not,
Again, thank you, ladies, both.
Thank you.
Have a great day. All right.